First of all, NfL has been investigated as serum biomarker for a closely related disease, multiple sclerosis, for many years, whereas serum GFAP is a relatively new topic. We know from older CSF studies that GFAP is elevated during attacks of NMOSD, and this has been now replicated with data in serum. We see that there is a correlation between serum GFAP and risk of relapse, as well as a correlation between the amount of disability as measured on the EDSS. And in particular, in the Momentum study, we have seen that serum GFAP tends to peak around the time of an attack, the more so in patients who were treated with placebo during the RCP, in contrast to patients who were treated with the serum, so Inebilizumab during the RCP. So in other words, to sum this up, this shows first that serum GFAP might be a valuable biomarker for disease monitoring, both in terms of adjudicating or predicting attack risks, as well as disability increase or disability progression. And it also shows that a potent immunotherapy such as Inebilizumab may reduce serum GFAP or may reduce the amount of tissue damage, which would then lead to a smaller increase of serum GFAP around the time of an attack, in contrast to patients not treated with a potent immunotherapy or treated with placebo. What needs to be done in the future, if I may add that, is to break this down into a easily applicable diagnostic tool for individual patients, because the problem is that you cannot send a patient in for a blood draw every other week or every week or so. This is just not feasible for various reasons. So the next step would be to develop a biomarker from tear fluid, for example, so measuring GFAP in tears, which is doable. And then this is something a patient could do on his own at his home. And if he or she detects any fluctuations of serum, or not serum, but then tear fluid GFAP to be correct, he or she could present to the doctor. We need to validate this in larger patient cohorts. We need to understand the range of measures or of values in healthy subjects. And we would need to investigate how this correlates with disability or with certain, let's say, severity of attacks. And this is something that has been launched, that is underway now and being investigated by several groups. And if everything goes well, this might be ready for clinical use within 2 years from now or so, approximately. That's my presumption.